Hey, Dr. Jennifer Neff. I would like to do a talk today about colds and flu. I'd like to keep the videos still short enough so that we can keep your attention, so we're going to do two videos. We're going to do a cold video and then we're going to do a flu video. And because we might not release those on the same day, what I want you to do is push that subscribe button and then turn on the notifications, so when the flu video comes out, then you'll get it, and then you'll get notified when all of my other videos come out, because I'm excited. This educational project has been really fun for me and fun for Kim, who you don't see. She's behind the camera and she manages me and the things that I do, but not the things that I say. Anyway, what we're doing is trying to get some education to you so that you can have the best possible health and the best possible health education, and so that you don't have to over or underutilize your doctor. So let me start with the cold. Cold is caused by a virus, and viruses are little teeny particles that go into the cells, usually of the nose and the mouth and the throat, and they start destroying those cells, and then you get symptoms. And it usually feels like runny nose, sneezing, postnasal drip, which means clear mucus that clogs up the back of your throat, and then you cough it up like like that. You can have a sore throat. You can have your tonsils inflamed because of a virus, and people can feel pretty icky. Sometimes it makes you feel run down, but usually a cold doesn't make you feel total body sick. It usually does not make you feel like you've been run over by a truck. If you feel total body sick and like you've been run over by a truck, then you got to think maybe it's the flu. So the cold viruses will give you a whole bunch of symptoms for 7 to 10 days, and sometimes while you're having one cold, you can actually catch another cold, because there's many different varieties of virus that can cause the same types of symptoms. I'm not going to bore you with them, but if you really want to look that up, then you can go look that up. So if you have the garden variety cold, you're going to usually feel crappy. And that's a medical word for not feeling good. You're going to feel crappy until 10 o'clock in the morning, and then you're going to clear out most of your mucus, and then between 10 and 4, you don't feel perfect because you're still sick a little bit, but you can function. And then after 4 o'clock, you start feeling more run down, and you start having more symptoms, and you start having more mucus and more coughing, and you start feeling sick again. And so that's why people start getting really frustrated, because they forgot that period of time in the middle of the day when they were feeling a little bit better. People get really sick of being sick, so they come in and they say, Dr. Neff, you need to do something. You need to give me an antibiotic to make this cold go away. And I say, guess what? Antibiotics kill bacteria, not viruses. And so what I am going to talk to you about is things that you can do for a cold. Now, what I need to let you know is that when mucus sits around, it turns colors. So in the morning, when you have a cold, you might cough up some yellow stuff. It might even be green. And then you can watch that go down the drain in the shower, and you can find that very amusing. And hopefully during the day it's going to clear up, because if you have clear mucus during the day, it is not a bronchitis, it is not a sinusitis, it is not a bacterial infection that I can give you an antibiotic to kill it. Actually, one of the best things that you can do for a viral infection is to treat it with salt water as soon as it shows up. Whenever I think that I'm getting sick, I'll do nasal saline rinses and saltwater gargles. Even if I'm not to the point of, oh, I finally identified this is definitely an illness. You know, that kind of somehow like little scratchy throat, not feel so good. That's the time when you get your nasal saline rinses going and when you get your saltwater gargles going, and then you can laugh about it, because that's exactly what your grandma told you to do, and she was right, because salt water is toxic to bacteria and viruses. Now we're talking about viruses not responding to antibacterial medication or antibiotics, but you do have salt water, so you can do that. One of the other things that can give you some relief while you are having a cold is, and I believe that this is true, vitamin D. I usually tell my patients double your vitamin D while you're sick. Vitamin C, 2,000 to 5,000 milligrams per day, and I usually take mine in the form of emergency. Those little packets, or you can have like C gummies or whatever, chewables if you want, but the vitamin C tends to boost your immune system, and it tends to help the body force the virus out a little bit sooner. The other thing that's kind of nice is zinc lozenges. Now zinc is to a certain extent antiviral. There used to be a product out that was a nose spray. Do not use the nose spray, because they were finding that it was taking away people's sense of smell. But zinc lozenges are lovely. You can actually take a zinc supplement as well, but I would caution you not to take that on an empty stomach, because then you're gonna wish that you didn't. Vitamins on an empty stomach don't make you feel so good all the time. So those are natural ways of helping you either shorten or prevent a cold. And when we're talking about over-the-counter medications, I think I'd like to do a whole nother video on those because it's pretty complicated. They're not every over-the-counter medication is not for everybody, and if you are on a lot of medications or if you have health concerns, then that's might be one of the times that you would pop a little message to your doctor and say, is it okay for me to take this particular thing for this? And then if you're on certain meds, they can say no. So what I'm trying to say is that some things are simple and some things are not simple. Now, if you've got a cold and it's been going on for more than 7 days, if you've got a cold and it's been going on for more than 7 days, you're coughing, you're up at night coughing, you're unable to shake it, then that might be when you start talking to the doctor about, hey, is this starting to become something that we might need to medicate, or is this something that we might need to worry about? Now, everybody always tells me the story about a cold and it started here and then it dropped down into my chest. And yeah, that does happen with some people, and some people are more predisposed to bronchitis and sometimes pneumonia. And if that's the case with you, then I would say go in a little bit earlier, especially if you're having wheezing, which sounds like this. Especially if you're having chunky stuff coming up from your chest that you're coughing out, not so good. And if you're having this rumbling in your chest, if your spouse is saying, I can hear you breathing, and they don't mean snoring, they mean I can hear in your lungs something is going on, then that's when you would go and you would have a doctor listen to your chest and maybe even get a chest x-ray to make sure that you don't have a lower respiratory infection, which is more serious. Colds are upper respiratory infections. So that's me talking about colds, and I will talk about flu next. So stay tuned and don't forget, hit subscribe. See you next time.